In a strategic move towards improving inclusive healthcare delivery, the Kaduna State Government has launched the first Nigeria costed implementation plan of 33 billion naira to improve sexual and reproductive health rights services for persons with disabilities across the state. The three-year plan roadmap, spanning from 2025 to 2027, first of its kind in Nigeria, was unveiled during a dissemination meeting with its partners, Sightsavers in Kaduna. The plan covers 5 thematic areas, from raising public awareness to addressing service delivery gaps, strengthening infrastructure, governance, and putting in place monitoring mechanisms. The program director of Sightsavers, Anita Gwom, highlighted major steps towards the equity in Nigeria's health sector, noting gaps for persons with disability to access quality health services and infrastructure. The Ministry of Health, Kaduna State, says the policy document is a bold commitment to equity, dignity, and human rights for persons with disabilities to move from the margins to the center of health systems.
Infrastructure barriers in the health facility, stigma, health worker attitude, because they are not even, they don't know how to, interact with persons living with disability. You can imagine if somebody with visual impairment, how can you go to the health facility to access primary care, or somebody with hearing impairment? So what the project did was to do the baseline. After the baseline, we train health facilities across 4 LGS in Kaduna State, train everybody working in the health facilities. We did facility modification, that means assessment. That means if somebody with wheelchair wants to come into the facility and there are steps to prevent him, is a barrier. So what Sightsavers did was to develop rounds, very simple modification in the environment, so that somebody with a wheelchair can walk into the health facility conveniently and access services.
The plan is expected to cost an estimated 33 billion naira over the 3-year period. Largely, most of the resources, about 31 billion, will be attributed to infrastructural upgrade. Care providers are not conversant with the way to communicate with persons with disabilities. For instance, if you take persons who have issues of deafness. So these are all issues that have been taken into cognizance in terms of providing appropriate facilities that will help increase access. And this is looking at both at the urban areas and of course at the rural areas.
Promoting sexual and reproductive health and rights, because we want people to be able to have their children, the number of children, to be able to determine the number of children they want to have. So this document is looking at this sexual and reproductive health for specifically for persons with disability, because over time this set of people have been neglected. Have the approval of the executive governor of Kaduna State to ensure that the health of the people is of paramount importance in the state.
The disability community expressed satisfaction with the policy document, highlighting the need to train and educate women on their rights to access healthcare at ease, calling for more proactive action.
First of all, they need to understand that it's their right, sexual and reproductive health right, and also for them to, because it's going to be a TOT. We are going to train the trainer. We are also going to train them on safeguarding. So issues of safeguarding relating to health can be reported. We know one thing is you knowing your rights, and the other is for your family, your community to support you in achieving that right.
Stakeholders insist that the 33 billion naira plan model for disability inclusive development calls for states and the federal government to take similar bold steps blueprint for disability inclusive healthcare in Nigeria.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.